Sleep is a basic necessity of life, but even more important is breathing. When you sleep, air travels through your nose and mouth, down the throat, and into your lungs. The narrowest part of the airway is at the junction where the soft palate, the tongue, and the back of the throat all compete for the same space. When you are awake, the muscles are tight, keeping the airway open. But when you sleep, these same muscles relax, causing the airway to narrow. As the air passes through the narrowed opening, the uvula and the surrounding tissues begin to vibrate, causing a condition known as snoring. If the tongue continues to fall back, it will cause the breathing to become slowed or completely stopped. This is known as obstructive sleep apnea. Sleep apnea can cause fragmented sleep, shorter lifespan, reduced quality of life, and even death. A comfortable and effective option for treating obstructive sleep apnea is with a custom-made, removable sleep appliance that a dentist trained in the treatment of sleep apnea can provide. With the sleep appliance in place, the lower jaw is prevented from falling back, keeping the tongue forward and the airway open. Often this will reduce or eliminate snoring and sleep apnea, providing the body with deep, restful sleep.